The human spine is an intricate marvel of nature, a testament to both strength and flexibility. It provides the structural support for our upright posture, enabling us to walk, run, and move with grace. The spine also acts as a protective channel for our delicate spinal cord, a vital communication pathway between the brain and the rest of the body. As we age, the intervertebral discs can degenerate, leading to herniations and painful nerve compression. The bones themselves can develop bony overgrowths, known as osteophytes, further compromising spinal stability and nerve function. For many individuals suffering from debilitating back pain and related conditions, surgery emerges as a beacon of hope. Traditional surgical approaches to the spine, while often effective, have not been without their drawbacks. Fortunately, the field of spinal surgery is on the cusp of a transformative revolution, fueled by groundbreaking advancements in minimally invasive techniques and artificial intelligence. At the forefront of this revolution is the extreme Lateral Interbody Fusion, a minimally invasive approach that has redefined the landscape of spinal surgery. XLIF allows surgeons to access the spine from the side of the body, minimizing disruption to the critical muscles and nerves that surround the spine. Coupled with the precision of XLIF, artificial intelligence is taking center stage, augmenting surgical planning, intraoperative decision-making, and post-operative care. AI-powered software can now analyze medical images with unparalleled accuracy, creating detailed three-dimensional models of the patient's spine. Here in Mexico, degenerative spinal conditions are a pervasive societal challenge. Millions of our fellow citizens grapple with the debilitating effects of back pain, herniated discs, spinal stenosis, and other spinal disorders. These conditions impose a profound burden on our healthcare system and exact a heavy toll on the lives of those affected. The World Health Organization estimates that low back pain is the leading cause of disability worldwide, and Mexico is no exception. A staggering 7 million Mexicans suffer from chronic lower back pain, a testament to the widespread nature of this silent epidemic. This translates to lost productivity, reduced quality of life, and a strain on our families and communities. Traditional open surgeries, while often successful, are not without their limitations. These procedures typically involve large incisions and extensive dissection of the muscles and soft tissue surrounding the spine. Patients undergoing traditional spinal surgery often face a long and arduous road to recovery, requiring weeks or even months of rehabilitation. The invasiveness of these procedures can lead to complications such as infection, bleeding, nerve damage, and chronic pain. Fortunately, the advent of minimally invasive techniques like XLIF, coupled with the transformative power of artificial intelligence, offers a beacon of hope for the future of spinal surgery. The advent of extreme lateral interbody fusion, or XLIF, marked a paradigm shift in spinal surgery, offering a minimally invasive alternative to traditional open approaches. Imagine a surgeon accessing the spine not from the back, but from the side, through a small incision in the patient's flank. This lateral approach allows us to reach the spine with minimal disruption to the surrounding tissues, ushering in a new era of precision and patient comfort. XLIF capitalizes on a natural corridor that exists, between the abdominal muscles and the retroperitoneal space, providing a direct pathway to the spine without the need for extensive muscle stripping. Reduced muscle trauma equates to less postoperative pain, allowing patients to ambulate sooner and begin their rehabilitation journey with greater comfort. Moreover, the direct lateral access provided by XLIF affords superior visualization of the intervertebral disc space, facilitating more precise implant placement and enhancing fusion rates. Accessing the spine through the lateral corridor is a delicate surgical ballet, a testament to both anatomical knowledge and surgical finesse. The procedure begins with a small incision in the patient's flank, typically on the side of the affected disc. Through this incision, we carefully navigate through the layers of muscle, using specialized retractors to gently dilate the psoas muscle. Once we have gently retracted the psoas, we gain access to the lateral aspect of the spine, where the intervertebral discs reside. Here, under fluoroscopic guidance, we can remove the damaged disc and insert an interbody cage, restoring proper disc height and spinal alignment. The lateral approach allows us to directly visualize and address the underlying pathology with minimal manipulation of the spinal cord and nerve roots. The versatility of XLIF has revolutionized the treatment of a wide range of spinal conditions, from degenerative disc disease and spondylolisthesis to spinal stenosis and vertebral fractures. In cases of herniated discs, XLIF allows us to remove the herniated disc material and decompress the affected nerve root through a minimally invasive approach. For patients with spondylolisthesis, XLIF enables us to realign the spine and stabilize the affected segment, preventing further slippage and neurological compromise. Patients undergoing XLIF typically experience faster recovery times, reduced post-operative pain, and shorter hospital stays compared to those undergoing traditional open procedures. Moreover, the minimally invasive nature of XLIF reduces the risk of complications such as infection, bleeding, and nerve damage, contributing to improved long-term outcomes. Imagine holding in your hands not just a patient's medical history, but a crystal ball capable of predicting their surgical journey with remarkable accuracy. In the realm of spinal surgery, where precision is paramount, AI is proving to be an invaluable ally. By analyzing a patient's unique anatomical features, medical history, and imaging data, AI algorithms can assist in determining the optimal surgical approach, implant selection, and even predict the likelihood of specific complications. This level of personalized surgical planning was once the stuff of science fiction, but today, it is rapidly becoming the standard of care. By leveraging the power of AI, we can minimize the uncertainty inherent in any surgical procedure, providing patients with a clearer understanding of their individual risks and potential outcomes. Among the many AI platforms emerging in the field of spinal surgery, SpineCloud stands as a shining example of innovation and clinical relevance. Developed by a team of leading spine surgeons and data scientists, SpineCloud harnesses the power of machine learning to analyze a vast repository of surgical cases. Imagine uploading a patient's MRI to SpineCloud, and within minutes, receiving a comprehensive report detailing not only the patient's specific spinal pathology, but also AI-generated recommendations for the most appropriate surgical approach. This level of personalized guidance empowers surgeons to approach each procedure with a heightened level of confidence and precision. SpineCloud also incorporates intraoperative neuromonitoring data, allowing surgeons to track nerve function in real time during surgery. The true beauty of AI lies not just in its ability to analyze data, but in its capacity for continuous learning. Each surgery performed, each data point collected, serves to refine the AI algorithms, making them smarter, more accurate, and more attuned to the nuances of spinal pathology and surgical intervention. Imagine a future where AI platforms like SpineCloud become an indispensable tool for surgical training, allowing residents and fellows to hone their skills in a virtual environment. As we continue to embrace the power of artificial intelligence, we unlock a world of possibilities, not just for improving surgical outcomes, but for advancing the field of spinal surgery as a whole. The operating room is now a realm where human expertise harmonizes with the precision of a robotic assistance. This is not to say that robots are replacing surgeons. Rather, they are evolving into an extension of our will, enhancing our capabilities. In the realm of XLIF, robotic assistance elevates precision to an entirely new level. Robotic systems such as the ExcelsiusGPS utilize sophisticated imaging technology to create a three-dimensional map of the patient's spine, allowing the surgeon to preoperatively plan the ideal trajectory for each pedicle screw. During surgery, the robotic arm guides the surgeon's hand, ensuring that the screw follows the pre-planned path with unwavering accuracy. This level of precision not only minimizes the risk of screw misplacement and potential nerve damage, but also optimizes screw placement for maximal biomechanical stability. The human eye, for all its wonders, is not without limitations. However, with the advent of computer vision, we can now augment our perception, unveiling hidden anatomical structures and physiological processes. In the operating room, computer vision is transforming XLIF into an even safer and more effective procedure. Imagine a computer algorithm capable of identifying and highlighting critical nerves in real time during surgery. This real-time nerve visualization provides us with an unprecedented level of situational awareness, allowing us to operate with greater confidence and precision. The journey of spinal surgery doesn't culminate in the operating room. It extends into the days, weeks, and months of post-operative recovery. Traditionally, this phase has relied heavily on standardized rehabilitation protocols, often failing to address the unique needs and recovery trajectories of individual patients. However, the integration of AI into post-operative care is poised to revolutionize this crucial phase, ushering in an era of personalized rehabilitation tailored to each patient's specific progress and challenges. Imagine a patient recovering from XLIF, equipped with a wearable sensor belt that continuously monitors their movement patterns, posture, and activity levels. This data, wirelessly transmitted to an AI-powered platform, provides real-time feedback to both the patient and their physical therapist, allowing for personalized adjustments to the rehabilitation program. If the patient favors one side while walking, the sensor detects the asymmetry, prompting targeted exercises to strengthen the weaker muscles and restore balanced movement. But the potential of AI in post-operative care extends far beyond movement analysis. Imagine an AI system capable of analyzing a patient's surgical data, medical history, and even their genetic profile to predict their likelihood of developing chronic pain after surgery. Armed with this knowledge, we can intervene early, implementing proactive pain management strategies and individualized rehabilitation programs designed to mitigate the risk of long-term pain and disability. As we venture further into the uncharted territory of AI-driven healthcare, we catch glimpses of a future where spinal conditions are not just treated, but predicted and prevented. Imagine a world where AI algorithms trained on vast data sets of genetic information, lifestyle factors, and imaging data can identify individuals at high risk of developing spinal degeneration even before any symptoms manifest. This early detection would empower us to shift our focus from reactive treatment to proactive prevention. We could implement personalized strategies tailored to each individual's risk profile, incorporating lifestyle modifications, targeted exercises, and even early interventions to slow or halt the progression of spinal degeneration. Imagine a future where debilitating back pain becomes a rarity rather than a societal norm. The ethical considerations surrounding AI in healthcare are undeniably complex and require careful navigation. We must ensure the AI algorithms are trained on diverse and representative datasets to avoid perpetuating existing healthcare disparities. Transparency and explainability of AI-driven decisions are paramount, allowing both patients and physicians to understand the rationale behind treatment recommendations. The fusion of XLIF and AI represents a paradigm shift in spinal surgery, heralding a new era of precision, personalization, and patient empowerment. As we continue to explore the vast potential of these technologies, we must do so responsibly, ethically, and with the ultimate goal of improving the lives of those entrusted to our care. The convergence of XLIF and artificial intelligence is not merely an evolution in spinal surgery, it is a profound revolution, reshaping the very landscape of how we approach spinal care. As we have explored, XLIF, with its minimally invasive nature and muscle-sparing approach, has already redefined surgical possibilities, offering patients faster recovery, reduced pain, and improved outcomes. Yet, when coupled with the cognitive prowess of AI, XLIF transcends its surgical origins, evolving into a comprehensive approach to spinal health that spans from preoperative planning to post-operative rehabilitation and beyond. Imagine a future where AI algorithms, fueled by the collective wisdom of countless surgical experiences, guide our hands with unparalleled precision, minimizing risks and optimizing outcomes. Imagine a future where wearable sensors and predictive analytics empower patients to take an active role in their recovery, preventing complications and restoring their mobility and quality of life. This is not a utopian vision. It is the future we are actively creating. One AI-powered insight, one robotic-assisted procedure, one data-driven rehabilitation plan at a time. However, as we embrace this technological revolution, we must proceed with both enthusiasm and vigilance. The ethical considerations surrounding AI in healthcare are profound and demand careful consideration. We must ensure that AI algorithms are trained on diverse and representative datasets, mitigating the risk of bias and promoting equitable access to these transformative technologies. Transparency and explainability of AI-driven decisions are paramount, empowering both patients and physicians to understand the rationale behind treatment recommendations. The future of spinal surgery is no longer a distant horizon. It is a rapidly approaching reality. Let us, as a surgical community, embrace the transformative potential of XLIF and AI, not as a replacement for our expertise, but as a powerful augmentation of our capabilities. Let us harness these tools responsibly and ethically, guided by the unwavering commitment to improving the lives of those entrusted to our care. Together we can usher in a new era of spinal surgery, one defined by precision, personalization, and the unwavering pursuit of optimal patient outcomes.